Hi, I'm Dr. Michael Workman, board certified plastic surgeon out of Vancouver, Washington, and today I'd like to briefly talk about the Vampire Breast Lift. Vampire Breast Lift was introduced last fall by a dermatologist who basically touted it as being a quick pick-me-up or a temporary fix for ripples in the breast. And in a word, in terms of whether or not to do it, no. The Vampire Breast Lift involves taking some of a patient's own blood. It is then spun down and the platelets are basically deactivated so that growth factors from within the platelets are then mixed with Juvederm or Restylane or one of the other injectables that we normally use with the face. This concoction is then injected back into the breast in a local area, and over the short term it will plump up the breast. It can decrease the effect of ripples or whatnot. However, I think it's critical to realize this is not tested. There are no scientific studies that have been peer-reviewed to look at this. The big concern among physicians is that there are growth factors in these platelets, and when one puts growth factors next to breast tissue, you may well increase the risk of cancer. Growth factors cause tissues and cells to regenerate quicker, and when one does that with a biologically active tissue like the breast, we just don't know what's going to happen. So I think that at this point, I'm aware of no universities or any other board certified plastic surgeons that are using it. I think it's best at this point to not do it. Let's wait until we can show that it does work and that it is not harmful. So that's kind of the bottom line on the Vampire Breast Lift. And the other thing I think it's important to note is the same procedure has been touted for use in the face. For the same reasons, I would not recommend any of my patients use it, and I think that there are enough good treatments out there in terms of fillers and whatnot, and neurotoxins, that I don't think we have to resort to things that are sensationalistic in terms of how they sound or that don't have a proven track record. This isn't cancer surgery. This is all for aesthetics, and I think we need to just kind of up our game in terms of keeping everything absolutely safe. So thanks a lot and have a great day.